onset of the monsoons has taken most people by surprise.
40,000 infections and 25 deaths in the first month.
When we were kids, we hadn't heard of dengue. All dengue endemic countries are having increasing dengue outbreaks every year. Things are getting worse because of climate change, so we have more mosquitoes to transmit the disease.
C'est vraiment un cas typique de la maladie du sommeil, ça. Comme médecin, effectivement, on enregistre des décès, mais c'est fin. Mais il y a ça, juste en regardant. Ça là, beaucoup. Bon, il n'arrive pas. Il a un problème de coordination. Ouais, c'est le stade. Beaucoup de décès des enfants. C'est ça qu'elle ne va pas regarder. Zongisa. Ça là, oui. Donc il y a beaucoup de signes neurologiques. Il est vraiment lourdement malade. Ça, c'est des choses, c'est des expériences noires hein, qui font mal. Un peu son âge. Ces patients négligés qui n'ont pas de porte-voix, ils ont des problèmes de santé, mais pour lesquels il n'y a pas de solutions adaptées. Ils n'intéressent personne. Bon, voilà. Et nous disons que ce sont des maladies des bouts de piste. Aller sur le terrain, chercher les patients ou arriver à atteindre les sites de ces cliniques, c'est un vrai défi.
Neglected patients live in very remote areas. And they're very poor.
We are not seeing a strong investment for diseases affecting billions of people all around the world.
You're in the shadow. Nobody knows about you. You're not even in any statistic because nobody knows you exist. Patients suffer in silence. I first heard of neglected diseases when I was really a young doctor working for the Kenya Medical Research Institute. We had so many patients suffering from these neglected diseases. Doctors in the field don't have treatments, and if treatments are there, they're toxic, they're not easy to use, they're ineffective. At the same time, the Doctors Without Borders, also working in the field, were noticing the same thing. When they won their Nobel Peace Prize, they decided this is the moment.
We look upon this as an opportunity to highlight the forgotten populations that exist in extremely precarious situations.
In 2003, people from all around the world, from Brazil, from India, Malaysia, Kenya, from Paris, from MSF, they came and they said, let's fix this situation and let's show that we can have an alternative model of research and development.
Our patients are dying, not because their diseases are incurable, but because as consumers, they do not provide a viable market for pharmaceutical products.
They created DNDi.
DNDi is a not-for-profit drug research and development organization that discovers, develops, and delivers treatments for neglected patients. When I look back to where we started, children were dying in great numbers. When DNDi was created in 2003, the first thing we did was new combination treatment for malaria.
Le premier traitement que DNDi a développé, c'est l'AZAC. C'est une combinaison artésunate amodiaquine pour le traitement du paludisme. Toutes les personnes, quel que soit l'âge, qui ne se sentent pas bien, ils savent, en fonction des lieux, de leur lieu de vie, il y a un site de traitement communautaire là-bas. Et ils vont là-bas, et il y a un test rapide qui est fait, puis il y a de l'ASA qui est donné et c'est gratuit. À travers le monde, il y a plus de 500 millions de personnes qui ont accès à l'ASAC. Les gens ont peur de la maladie du sommeil parce que c'est une maladie qui évolue et qui touche le système nerveux central, donc le cerveau. Quand elle touche le cerveau, il y a des gens qui ont des signes qui sont stigmatisés pour ça.
And the treatment that was there was very toxic. Killed in 1 in 20 patients. The patients were feeling like there was fire in their veins.
Il y avait besoin qu'on ait un comprimé. Nous avons mis en place le site et puis nous avons fait cet essai qui, heureusement, a abouti. Un peu en 2018, nous avons le fexinidazole qui est enregistré. Premier traitement oral disponible, enregistré en RDC. La différence que fexinidazole fait, c'est que c'est un traitement qui est très facile à administrer. Ok, madame, c'est bon. C'est un traitement qui peut être administré même à la maison. C'est un traitement qui peut être administré dans les villages les plus reculés.
10 jours.
Take this treatment at home and you're cured of your sleeping sickness. That is a dream. It's like magic.
Nous sommes fiers de ça et d'avoir participé à ça. Les enfants vivant avec VIH sont dans la catégorie des patients négligés puisqu'il n'y avait pas de formulation pédiatrique adaptée.
If the treatment is not started within the first year of their life, close to 75% of them will be dead by the time they are 5 years of age.
Avant, nous avions des traitements, des sirops qui n'avaient pas forcément un bon goût, qui n'avaient pas une bonne odeur, pas facile à donner aux enfants. DNDi a développé une combinaison de 4 antirétroviraux en un, mais très facile à administrer puisque c'est une capsule avec des granules et qui peuvent aller dans la bouillie de l'enfant, dans son thé. Et puis bon, tu peux mettre dans une nourriture solide, comme tu peux mettre dans la bouillie, et voilà. C'est très facile, ça rend facile la vie du parent qui doit chaque jour donner le médicament à l'enfant.
Many people did not believe that we could actually deliver any treatments using this non-for-profit research and development model in very, very remote areas. But in 20 years, we have delivered 12 treatments.
Nous arrivons à le faire, ces essais sophistiqués, mais dans ces milieux-là. Et ça, nous sommes dans notre élément. Il y a 20 ans, je n'avais pas ces médicaments quand je voulais traiter les patients. Des expériences que la prochaine génération de médecins ne va pas vivre. Il ne va pas connaître la mortalité, le décès que nous.
We've been able to save millions of lives, but it's not over.
A doença de Chagas é uma doença que foi descrita há mais de 100 anos.
Não existe mais a condições do tratamento da doença de Chagas em si.
Então, o que acontece muitas vezes é que esses pacientes eles são infectados pelos parasitas ainda na infância e então esse quadro ele evolui ao longo dos anos, muitas vezes passando totalmente despercebido pelos pacientes.
And 20, 30 years or more later, you can just drop dead.
Vou morrer com a doença de Chagas. Eu acho que é o maior medo deles. අවට ඩෙන්ගු තියෙනවා. ඩෙන්ගු ඉස්සරහා ගෙවල් වල ළමයින්ටත් හැදුනා.
Dengue is caused when Aedes mosquito infects you.
ගොඩාක් කට්ටිය පොඩි ඉඩක ඉන්න හින්දා කුණු තියෙනවා, වතුර රැඳෙන තැන් තියෙනවා.
Despite causing really havoc for over 30 years in Southeast Asia and Latin America, unfortunately we still don't have a treatment for dengue.
ඊට ඩෙන්ගු කිව්වට පස්සේ තවත් බය වුණා. බය වුණා ඉතින් කවුරුත් මොනවා හරි මට මොනවා හරිනොත් වෙන කවුරුත් නැහැ. ඊට මට ළමයිට බඩගින්නින් තියන්නත් බෑ. මට බඩගින්න ඉන්නත් බෑ.
How we have reduced case fatality rate is by doing this really intense monitoring to find out when people are going to develop complications. It's a huge workload for these nurses and doctors.
Pois são os pacientes que, de fato, vão nos passar as informações sobre o que é um tratamento, que seria um tratamento adequado e inovador para esses pacientes.
This is why at DNDi we have an alternative model, not based on profit, but is based on patient needs.
Muitas vezes esses pacientes vivem em áreas rurais, longe dos sistemas de saúde, vivem sem diagnóstico. Eles ainda sofrem muito com essas doenças. E gera senso de urgência. Como pesquisadores, são necessários novos tratamentos.
Porque eu gosto de mal, eu não ia fazer o...
Então é muito importante, e parte da forma como a DNDi atua, fazer essa conexão entre quase dois mundos diferentes. Um mundo de pessoas negligenciadas, sendo impactadas por doenças, com super avançado e de tecnologia de ponta.
We would like to go for new chemical entities, new drugs for targets.
A DNDi, nos seus esforços de descoberta de novos medicamentos, trabalha com os melhores parceiros, os melhores grupos de investigação ao redor do mundo. Diferentes tipos de parceiro na universidade, institutos de pesquisa, empresas, incluindo áreas endêmicas.
This alternative model is about partnerships.
The way we do research needs to change. Working in isolation, not sharing data, actually hinders the development of science. What DNDi has done is form this global alliance for dengue to find treatment solutions. We have to accelerate the treatment development for dengue. It's not the time to wait until somebody else finds you a solution. It's about us finding solutions ourselves.
We have reached 20 years, but the work has only just begun.
C'est un avenir pour moi qui est fait encore de défis.
Conflicts, economic crisis, the climate crisis are extremely hard for neglected populations.
We know that there are more and more pandemics coming, whether we like it or not.
Mais c'est un avenir qui est fait de beaucoup d'optimisme puisque nous avons acquis de l'expérience. Nous sommes en train de nous engager sur d'autres pathologies.
We are going towards the last mile. We are headed towards elimination of sleeping sickness.
As a doctor, you can save thousands of lives. But if you discover a drug, you end up saving millions of lives.
DNDi, it's about people from the beginning. People from all around the world that decided to gather their expertise to think about what this model could be. We know that we still have challenges, but we stay committed to continue bringing the best science for the most neglected.